I'm Lieutenant Jenna DiMaggio, and I'm a nurse here on the inpatient pediatric ward. I started in 29 Palms and they placed me on labor and delivery, which is not where I wanted to go, but in the end I was very thankful. And when I came to Balboa, I wanted to come to peds, and that's where I ended up. I love pediatrics. I like kids. That's where my passion lies, so I enjoy it a lot. Some days I'm in the office as the assistant division officer doing administrative things, working on the schedule, training records, or any day-to-day business, going to meetings. And other days I work as a nurse on the floor, whether it's charge nurse or taking patients or helping other nurses. I like sometimes that you don't have to be so serious with the kids, and you can play with them and have a less serious tone with them. It makes it more fun. I remember I had a patient who was having a lot of trouble breastfeeding, and her daughter, who was a newborn, had lost 19% of her birth weight, which is a lot. I remember she was very upset, and I went to check on her a couple days in a row, and she made me a keychain with my name on it, just like this. And that's something that's always stood out in my mind as one of the memories where, wow, I really appreciated this patient. One thing I love about nursing is it's so diverse. You can work in so many different areas and go so many different ways. There's a ton of specialties inpatient-wise. You can also work in the outpatient clinics. And for nurses, we have the ability to deploy on the humanitarian missions. Since I've been little, I've been wanting to help people in developing countries, especially in the medical aspect. So I was able to go on Pacific Partnership 2013 on the USS Pearl Harbor, and I was actually one of the executors of the mission, so I got to go out and do engagements in Samoa and Tonga. So I've been fortunate to be a member of the planning and advon team for Pacific Partnership 2015, so I just love all the different opportunities that we're afforded, especially in the Navy Nurse Corps. I'd love to make a career out of the Navy. I think the Nurse Corps, like I said, has so many opportunities for us. And I hope to just continue on the path that I've had and keep getting more experiences and eventually go to DUINS to become a midwife. I am Lieutenant Jenna DiMaggio, and I am NMCSD.